So if your number is 5, you just type in the number 5, that's it. If you put in a 0.0 at the end of a 5, it can accidentally look like a 50. Okay, so those are our rules as far as zeros. Put a 0 in ahead of a decimal, but don't put a 0 in behind a decimal. And then finally, if your math answer is a number like 1,000, we do not use a comma in nursing because a comma can accidentally be misconstrued as a decimal. So if your number is 1,000, you just type in 1000. Those are just our little tips on math calculations. Remember that you will have a dry erase board or a whiteboard to do your calculation, and you'll have your on-screen calculator. And we're going to do a math question here coming up in this session. So let's get right into question number 1 from Pharmacology and Parenteral Therapies. Remember, in the student chat, don't put your answers. Help me get the topic, and then we'll go from there, okay? The nurse provides care for a client during an autologous blood transfusion. The client reports chills 30 minutes after the transfusion began. The client's blood pressure has decreased from 122 to 108. Which action will the nurse take first? First action means priority. Priority with a blood transfusion reaction. Good. And it is an autologous transfusion. That's an important word because autologous means blood from self. When you have blood from yourself and you get a reaction, there's really only one reaction that can happen, and that is bacterial contamination. So that means that this blood has been stored improperly, or it's running through a contaminated line perhaps. So this is causing symptoms of a bacterial infection. So priority means we're going to do A's and I's, right? Assessments and implementations. Number 1, administer imipenem-cilastatin. 2, administer sodium chloride. 3, stop the transfusion and remove the tubing immediately. And 4, check the temperature. We've got one assessment answer, so we look at that one first. So let's ask ourselves, we're talking about number 4. When I have someone who's receiving their own blood and they're having a complication from it, do I need this assessment in number 4? Now, I don't have a temperature or an oxygen saturation yet up in the question, but I think there's a problem. Do I need this assessment data in 4 to confirm that there's a problem? And all of you are saying, nope, no, Elisa, we don't need that assessment data. Good. I have enough assessment data to know that there is a problem with the blood, and I know what the next nursing action is, and it is not to get any more data, so we get rid of our assessment. Now I'm looking at my implementations. They are all physical answer choices. Now, if there was anything psychosocial up there, would you feel comfortable eliminating the psychosocial answers? Yeah, because we've got a physical problem with a blood transfusion. We don't need any psychosocial care, so we would eliminate psychosocials. And then we could go with ABCs next. Number 1, administering a medication is not a circulatory answer choice. 2, giving fluids is circulatory. And 3 is stopping what is going into the circulatory system. So let's eliminate number 1 because, first of all, it's not the correct action, but it's also not addressing the C, circulatory complication. And then between 2 and 3, what does a nursing textbook say is the first thing, and I can see you guys using the poll, we know the first thing that we need to do is number 3, stop the transfusion and remove the tubing. Then we would start sodium chloride infusing. So we can see that in priority questions, more than one answer can be correct, but it's very specifically forcing us to choose just one. And it is asking what we do first. We have to get rid of that tubing, and then we can start normal saline through fresh tubing. All right, excellent. One question down, many to go. We're moving kind of quickly. If you're going to ask a question in the private chat, please just make sure you tell them what question number you're going to talk to them about, okay? Here comes our next one. The healthcare provider prescribes 5% dextrose in water, D5W, IV fluid for an older adult client. Which action by the nurse is best? So let's get our topic. Best means priority. Good, Nagena. Gerontology, circulation, priority. Good. And I'm also noticing it's D5W. So in my mind, I say to myself, isotonic, but it acts like a hypotonic fluid in the body. That's just what my mind says when I see D5W. All right, good. So I like the topics you guys are coming up with. Priority, infusion, and let's also think about age-appropriate care, older adult. So now that we know it's a priority question, we can go to step 2, A's and I's. Number one, if I instruct the client to breathe slowly and deeply during auscultation of the posterior chest. While I'm auscultating, am I getting information? Yes. So number one is an assessment. Okay. 2, apply the tourniquet 1 to 2 inches above the site. 3, apply a blood pressure cuff above the IV insertion site and inflate to the same level as the systolic pressure. That's an implementation. And 4, start the IV dorsal veins non-dominant side implementation. So there's one assessment. Now, when there's one assessment and 3 implementations, which answer choice do we look at first? The assessment, good. Do I have that information up in the question? Do I have knowledge about my patient's lung status? No. Would it be helpful to listen to an older client's lungs before starting IV fluids? Yes, good. It'd be good to get a baseline of their lung status because elderly people are at risk for fluid volume overload when we give them IV fluids. So I think number 1 sounds like a good assessment. I don't have that information yet. It would be addressing the safety, right? Get that assessment prior to starting fluids because I want to address the safety issue of potential fluid volume overload. So I like 1. Let's hang on to it. Let's just, using step 2, think about the implementations. Because we think 1 is good. How about 2? Tourniquet 1 to 2 inches above the IV insertion site. Any thoughts on that implementation? You guys are saying no. Okay, so a tourniquet should not be that close. Good, Shannon. The textbook teaches at least 4 inches away from the IV insertion site. How about number 3? Now, number 3 is suggesting that we use a blood pressure cuff as a tourniquet. And if you don't have a tourniquet available, you could use a blood pressure cuff to get that pressure in the cardiovascular system so you can find the vein, but it should not be inflated to the systolic pressure. Okay? If you're going to use a blood pressure cuff as a tourniquet, it should be inflated only to the diastolic pressure. So 3 is definitely not best because it's just like number 2, it's not good. And then how about 4? Any thoughts on 4? Dorsal veins, forearm on the non-dominant side. We kind of like that one? Okay. And the whole idea of non-dominant is we want to keep our patients as independent as possible. That's a rule. So it does make sense to use their non-dominant side to start an IV. Okay. So if I like an assessment and I like an implementation and I'm down to 1 and 4, is one of them more addressing the safety? We talked about when you're between 2 answer choices. Remember, the test is ultimately testing you on nursing safety. Number 1 is addressing the safety because the complication of starting these fluids could be fluid volume overload. And then how about this? When you're between an assessment and an implementation, if it's a toss-up and you're really like, oh, I just don't know for sure, don't forget, when you're between an assessment and an implementation, assess is best unless the patient is in distress. This patient isn't in distress. I have no emergency situation where I need to act fast and implement. So assess is best. Let's gather that data. Now, after I start fluids on my elderly client, I can reassess lung sounds a couple hours later, and that will help me compare back to their lung sounds prior to starting the infusion. So 1 is the proper assessment before starting fluids on an older adult. Very good. You like that? Because I saw you guys were in between 1 and 4, right? Good job. Now, I don't see all the students in the class using the polls. Just so you know, I can't see who's picking which answer. It's totally anonymous. I can just see the number of students picking each answer. So I don't want you to be afraid to use the polls. This is a great place to make mistakes. Don't worry about being embarrassed. No one's ever going to call you out for your wrong answer choices, okay? Just try to get used to using those polls because it helps you with making decisions about answer choices, okay? All right, let's do number 3. Now, this one's a select all that apply. So remember, you've got to give them a minute to change the poll. But let's get our topic first anyway. The nurse provides care for a client diagnosed with a compound fracture of the left femur. The vital signs are Blood pressure 80/60, pulse 120, and respirations 26. Which IV fluid does the nurse question? Now, when it says IV fluid the nurse questions, that means I am looking for something wrong. Something wrong, because I will question a fluid that is wrong. Very good, Jessica. So what fluid not to use with? What? Can anyone figure out what's a one word? Okay, I see hemorrhage, fracture. When you have fracture, hemorrhage, and a dropping blood pressure, good, Julia, shock. Yeah, hypovolemic shock is our topic. We are looking for the incorrect IV fluid with shock. So go ahead and start using the poll for your select all that apply. And I'm going to talk through tonicity for just a minute here. Isotonic fluids stay in the cardiovascular system. They don't cause a lot of water to go out into the cells. They don't necessarily pull a lot of fluid into them. So isotonic fluids are okay for someone in shock. Hypotonic fluids are the fluids that cause water to leave the cardiovascular system. Hypo, O, water goes out. So with hypotonic fluids, there is a concern that we may see a drop in blood pressure when we give a hypotonic fluid. And then we have hypertonic fluids. ER, enter, hypertonic fluids cause fluid to enter the cardiovascular system. So hypertonic fluid would be okay for someone in shock. So really, I'm looking for the fluid that is dangerous in shock, which is hypotonic fluid. So now I can go through and ask myself, related to the tonicity of this fluid, is it dangerous? Number one, lactated ringers, isotonic. Is it dangerous for someone in shock? No. Number two, 0.45 sodium chloride. That one is hypotonic. So that one is one we will question. Yeah, let's check the box for that one. We're going to question it because it's hypo. Number three, 0.9 sodium chloride is an isotonic fluid. So no need to question that one. Number four, hydroxyethyl starch is a hypertonic solution, so that'll increase circulating blood volume. No need to question that one. And then, do you recall in the previous question, it was about the older client with D5W? And I told you, when I see D5W, I think to myself, it's an isotonic fluid, but it becomes hypo in the body. So just stay with me here. If D5W is iso, what is 2.5 dextrose in water, which is also known as D2.5W? If D5 is iso, D2.5, which is less than 5, is hypo. So do I question that one? Yeah, I question the hypotonic fluids. So the two fluids up here that would be questionable for someone who's already looking to be in hypovolemic shock would be number 2 and number 5, my hypotonic fluids. So my point here in putting all this information up on the screen for you guys is to remind you, study your fluids and know the tonicities of your basic IV fluids. If that is something you struggle with, remember you have a piece of paper where you're jotting down what you know you need to review for the NCLEX, right? So you might have peritoneal dialysis on your list. Yeah. So D5W is iso. And therefore, when I'm looking at D2.5W, 2.5 is less than 5. So if D5, which basically means 5% dextrose in water, if D5 is the isotonic dextrose solution, then anything less than 5% will be hypo. And as far as your dextrose solutions, what is a hypertonic? We've got D2.5 is hypo, D5 is iso. Anything more than D5 would be hyper. Very good. Woolsey. Okay. So Shannon, D5, right. So Shannon, D5W is isotonic by definition because it's 5% dextrose. But as soon as that D5 enters the cardiovascular system, the insulin in the body is going to break down the dextrose. So it becomes free water in the body. So it inside the body, shortly after it's infused, it'll start to act like a hypotonic fluid. And then Nagena, D2.5 also will turn into free water once it's in the body. So it's hypo from the moment it goes in, and it acts like a hypotonic fluid. So you guys are right, like a 10%, D5, D10, D50 even. D50, you push when someone's got severely low blood sugar. Those are all hypertonic sugar solutions. So don't forget that we've got some great channel sessions. If you want a review of fluids, look for the channel session. And yes, Shannon, I would definitely select it if it was there. Good thinking. Very good, Priscilla. Alrighty, good job. That might have brought up a lot of questions, but I think we did good on that one. Okay. Let's try this one. The nurse provides care for a client receiving parenteral nutrition through a central venous access device. Which action is most important for the nurse to implement? Most important, that means priority. Priority with what? Well, it looks to me like the topic is parenteral nutrition and a central line. Central venous access device just means central line. And let's see here. Okay, so let's do our A's and I's. Help me out here in the chat. Remove the old dressing over the insertion site, moving against the direction the catheter is inserted. Good. Clean the insertion site with an alcohol swab, moving from outside to inside. Flush the unused catheter lumens with a 10 ml syringe and reassure. So see, I'm looking at the verb because that helps me determine if it's an A or an I, and you guys are right, they're all I's. So when they're all I's, I go next to physical and psychosocial. It sounds to me like it's a physical topic, right? So number 1 is about the dressing is physical. Good. 2, cleaning is physical. 3, flushing is physical. And we land on number 4 being psychosocial. So can we all agree that we can eliminate number 4? Because although it's a true statement, it is not my priority. Good. All right. So our next step, remember we got our poster here. We can always look over to the poster to see what's our next step in thinking. It would be ABCs. Okay, but I don't really have any ABC answer choices. So that's okay, we get to step 5, outcome. Notice that none of the answer choices are about parenteral nutrition. So it's really just about central line. In fact, it seems to be about a central line dressing change, really. So that's okay, we'll go with that. Is number 1 the most important thing to do? Well, let's think about it. If I have a central line dressing and it's kind of rectangular shaped, and let's say that the line went into the patient in this direction, okay? If you're looking at my picture here, you can see the arrow is pointing the direction that the line was inserted, and number 1 is suggesting to remove the dressing in the opposite direction. See how drawing a picture makes me go, oh yeah, I learned don't do that, because that would pull the line out, right? We were taught very specifically not to do number 1. Could pull it out. Not so much that it could cause infection, Nicole, but that we were always taught to pull in the direction the catheter was inserted, because it's very important that we don't dislodge the catheter. All right, so now let's look at 2. Clean from the outside to the inside. Well, that one is about infection, right? Because we were taught start at the inside and move towards the outside, because we don't want to contaminate the insertion site with any bacteria that might be closer to the outside of the insertion site. So that leaves me with number 3, and that's all right. When I use my decision tree and it gets me down to one answer, I'm going to trust that that must be the answer. And it does indeed make sense. Of these answer choices, the most important one is number 3. So a central line is going to have usually 2 or 3 lumen. And if any of those are unused as a part of this line, we should flush the unused one. Make sure that they okay? And about parenteral, right? Parenteral nutrition is a tricky topic. Just FYI, parenteral nutrition is hypertonic, okay? But sometimes you read the question and you think the topic is something, and then you get to the answer choices and realize the topic is maybe a little bit different. So if you read parenteral nutrition and you got nervous about it, This is me reminding you that always stay confident right through till the end of the question, because sometimes it's not quite as tricky as you anticipate it would be. And you always have to say to yourself, I passed nursing school. I have what it takes to answer this question. Okay? Excellent. All right. We're going to go next to question number 6. Okay, here we go. Question 6. The nurse teaches a client about lorazepam. Which statement requires an intervention by the nurse? Aha. Now this is an evaluation question. So let's just stop for a minute here. We said before that priority questions ask us, what is first? What is next? What is best? What is most important? This one is asking for which statement requires an intervention. So very good, Rachel. It's asking us for teaching evaluation. Something wrong. Now, when you recognize that a question is asking you for something right versus something wrong, it immediately can become an evaluation question. So we're going to say to ourselves, something wrong. I'm looking for something wrong, and you guys already said it here. It's a benzodiazepine. So here's how we're going to think about it. Let's ask ourselves, is there anything wrong or concerning when my patient says, number 1, if the dose is increased, I may feel more sleepy than usual? Well, benzos do cause sleepiness. So that's not really concerning. It's a true statement, right? And I'm looking for the things that are wrong. So let's look at number 2. I should follow my regular diet when taking this medication. Well, that's a true statement. There are no specific dietary concerns with benzodiazepines, and I'm looking for something wrong. That one's right. I may feel dizzy when I take this medication. Well, I just taught my patient about this med, and hopefully I did teach them that this medication can cause some dizziness. So I'm left with 4. If I have problems with this medication, I should stop it immediately. And that is wrong, right? Because benzodiazepines come with a risk for tolerance, and they should be tapered off. So that word immediately is a very strong word. And when I think about its significance with this question, if you have problems with this medication, I don't want you to stop it immediately. You're going to go into withdrawal. So if you have problems, we want you to notify your healthcare provider, and your healthcare provider will give you a tapered dose. So let's talk about the word immediately for just a minute. Immediately is a really strong word. What are some other strong words that would grab your visual attention when you see them on the screen? All, always, never, stat, never, only, suddenly. Good. Yeah. So you guys got it. Like, pay attention to strong words, right? But here's the thing. I am not going to teach you that every time you see a strong word, that's your correct answer. That's definitely not true. Sometimes we do things immediately in nursing, and that's not wrong. Okay? So when you see those strong words, all we're teaching is make sure you consider what is the significance of this strong word and how does it relate to this particular situation. Because it is true that sometimes we do things immediately. If you're having shortness of breath, I am going to sit you up immediately. And that's not bad. Okay? So every time we see strong words, I would love for you to throw them in the chat and point out to me that you're recognizing that you see a strong word. Yeah, see, Karen, that's the thing. Sometimes there is a strong word in the answer choice. We have to always evaluate it. So I think what you heard, Karen, is wrong. I think that if someone said to you, try to avoid picking answer choices that have strong words in them, I don't think that's very good advice. But instead, let's pay attention to the strong wording and evaluate it. Yeah, exactly. But let's just evaluate it based on the context of the situation. Okay? All right. Good job, good job. Yeah, you're right, Nicole. Okay, now 7 is going to be a select all and apply. So how do we do select all and apply? We always get our topic. And remember, it's always a true, false, right, wrong situation. It says a client diagnosed with a bacterial infection reports hives and difficulty breathing after starting amoxicillin 10 years ago. The client reports a history of allergy to sulfonamides. Which prescription does the nurse question? Well, if I question it, it's because I'm looking for something wrong. I'm questioning things that are wrong. Wrong related to what? My patient has an allergy to, Nicole says, sulfa. Good. What else do they have an allergy to? Penicillin, right? It says right here, allergy to sulfa, But it also gives me this information that says 10 years ago they had hives and difficulty breathing. Well, allergies don't go away, right? So if you had an allergic reaction 10 years ago, I'm a good safe nurse and I'm going to call that you're allergic to it today also. So this patient has an allergy to both of these meds, Cillins and sulfas. Cillins end in Cillin. Sulfas begin with SULF. What's the one other thing I need to know about allergies to amoxicillin, to penicillin drugs? Is there one more class of medication we want to be worried about, guys? Cephs, very good. Cephalosporins have cross allergies with penicillins. So I'm looking for something wrong. Am I concerned about number one, a tetracycline hydrochloride antibiotic? Well, it's not a sulfa, it's not a Cillin, and it's not a cephalosporin. So no need to be concerned about this one. Number two, cephalexin. That one starts in CEPH. That's a cephalosporin, yes. Number three, azithromycin. That one is a macrolide. There's no cross allergies here with macrolides, so no to three. Ciprofloxacin is a fluoroquinolone. No cross allergy here. Okay, Cipro, it starts with a C, but it's not a ceph. Good. And then piperacillin, it has that ending, that suffix of cillin. So yes for number 5. And then it looks like you guys are getting it in the poll. Good. Cefepime CEF is a cephalosporin. So the cephalosporins are a little bit tricky because there's first, second, and third generation. They can start with CEPH, CEF, or KEF. So you actually have 3 prefixes that are all associated with cephalosporins. So you see how this is illustrating the whole idea of look for something unique about that medication. Like it is very unique that Cillins and cephs have cross allergies with each other. So as you're studying pharmacology and you start to see those unique pieces of information, that's going to start to stand out to you. So you know, like highlight that, study that, because that's very testable. All right, good job there. Excellent. We're going to go to question number 9 next. And this one is a math question. So give us a minute here to change the poll. We're going to give you a poll that you haven't seen before. It allows you to type your answer in so that you don't type your answer in the chat. Because see, we don't want to interrupt anyone else's math. So don't put your answer in the chat, please. Okay. The healthcare provider prescribes amoxicillin trihydrate 20 milligrams per kilogram per day, PO in 3 divided doses, administered every 8 hours for a 12-year-old client. The client weighs 105.6 pounds, which is 48 kilograms. How many milligrams does the nurse administer for each dose? Well, we're still going to use step 1 of our tree. It's very important. What's our topic? Our topic is how many milligrams to administer for each dose. Milligrams per dose, not per day. So we're going to come back at the end of our math and make sure that we calculated for each dose. All right, so when you're doing your math questions, I just want to caution you to pay attention to what are the numbers available on the screen and which numbers do you need. Like, for example, I see the number 12 for a 12-year-old, but we don't need it. And I see the weight in pounds, but we don't need it. We need weight in kilograms, and it's already given to us, okay? So oftentimes the NCLEX gives you more numbers than needed to perform your math calculation. It makes it a higher level difficulty question, right? Okay, so I can see that some of you are typing your answer in the box. That's awesome. Remember, you can either use your whiteboard or you can use your calculator on the screen. And our math is 960 milligrams per day, and then we have to divide that out by 3 because there are 3 doses per day, and that gives us 320 milligrams per dose. And of course, it is not 320.0 because we already studied that, right? We don't add a 0.0 at the end of a whole number. All right, so it looks like 99% of you got the correct answer on that one. Awesome. The channel also has a session on math calculation for the NCLEX. So if you do feel like math is kind of a sticky area for you, you can plan to attend that channel session and get some additional practice and guidance with math questions. Okay, great job. Number 10, the nurse provides care for a client receiving propranolol. Which question is most important for the nurse to ask? Well, most important means priority. Priority with what? Propranolol. Beta blocker. Okay, good. Katie says beta blocker and safety. Good. Beta blockers are frequently tested medications. So let's just evaluate each of these and do A's and I's. Number 1, have you experienced a dry cough early in the morning? 2, how would you describe your breathing? 3, have you noticed a decrease in your urine output? And 4, describe your sleep pattern to me. So they're all assessments. And is there anything up here that's psychosocial that we would eliminate? We've got cough, breathing, urine, and sleep. Those are all pretty physical. ABCs, those might help. Number 1, airway breathing. 2, airway breathing. 3, maybe a C. And 4, not airway breathing, right? Sleep pattern is not airway breathing. Okay, so let's look at 4 and see if we can eliminate that one first. I feel pretty confident that when someone's on a beta blocker, which is usually given for blood pressure, I'm pretty confident that assessing their sleep pattern is not my biggest priority. So I'm pretty confident in getting rid of that one. Now when I have 2 B's and a C, let's see if we can eliminate the C. Let's eliminate that one next. And isn't it true that, I'm not very concerned about your urine output when you're on a beta blocker. This is more about blood pressure. There's not really a direct concern with urine, so we can get rid of that one. Now I've got 2 breathing answer choices. Let's use step 5 and let's think about, is this appropriate for this topic? Number 1, dry cough. Number 2, breathing. Well, what is it about a dry cough? What do we know about a dry cough? And is it with a beta blocker? Very good, Nicole. ACE inhibitor. Right. So number 1 is off topic because that is not the question to ask when you're on a beta blocker. That's the question to ask when a patient's on an ACE inhibitor. So that leaves me with 2. And yes, indeed, beta blockers can cause bronchoconstriction, which can lead to bronchospasm. So yeah, if someone is receiving a beta blocker, it is good and safe nursing to ask them about their breathing, because I'm proving that I can assess for this safety concern while on this medication. Awesome. Good job. ACE inhibitor, give them an ACE and they'll cough in your face. All right, let's go to number 11. Oh, now watch this. We're going to do our first Who Do You See First? And when we do that, we pull up our Who Do You See First poster. It says the nurse provides care for 4 clients. Which med does the nurse administer first? So it's a priority patient, but we don't call it a priority question. Remember, priority questions use all 5 steps of the tree. And Who Do You See First doesn't use all 5 steps of the tree. We use the Who Do You See First poster. So help me out with this. Our topic is most unstable patient. We're thinking about, given this medication and given their disease and their symptoms, are they stable or unstable? Number 1, prednisone 60 orally for a client with MS reporting increased muscle weakness and fatigue. What do you think about just that one alone? Stable or unstable? A lot of you are saying stable, expected, okay. How about number 2, pyridostigmine 75 sub-Q for a client with MG, myasthenia gravis, reporting increased difficulty chewing. McGinnis says unstable. A couple of you are saying unstable. Yeah, myasthenia gravis is progressive, and when they get into myasthenic crisis, it does often progress quickly. And I know that myasthenia gravis patients, they deal with muscular weakness throughout their whole body, but my big concern is when this muscular weakness starts to affect their breathing. So number 2 to me looks unstable because they're having increased difficulty chewing that's involving the airway. Number 3, benztropine 1 milligram orally for a client with Parkinson who is drooling. Most of you are saying stable. I see a couple unstables for 3. Now the drooling part, sure, drooling is a risk for aspiration. However, drooling is common and expected with Parkinson's disease. So I think 3 is a little more stable. And let's do 4, and then we'll go back. I'll address the comment on 1. Okay, number 4, heparin 5000 sub-Q for a client with a thrombotic stroke 48 hours ago. I'll talk to you about that in a second, Shannon. Katie says 4 is a high-risk patient and acute. I disagree, though. Okay, so this is kind of what I expected. Some of you are saying 4 is unstable. I disagree, so listen to me for a minute, okay? Because I'm a neuro nurse, remember? And when I see that my patient is due for a shot of heparin subcutaneously when they had a stroke 2 days ago, I say to myself, that patient is stable right now in this moment. 2 days ago, they weren't stable, but they had a stroke 2 days ago. They survived. Now they just need their daily dose of heparin. It's just a scheduled, no, it says subcutaneous in number 4, Vaniqua. So what I'm really looking at is the subcutaneous part and the 48 hours ago part. So 48 hours ago, they were very unstable, but now this is, like Michael says, prophylaxis so they don't have another stroke. So this is just a routine scheduled medication. It's not being given because of anything acute going on right now. So 4 is stable. Now, let's go back to 1. Some people said, I'm not really sure about 1. Oh yeah, you're right, Vaniqua. Now, some people are saying with number 1, they're like, Elisa, I don't know, increased muscle weakness and fatigue. So you guys are good for noticing that word. And you're like, I don't really know if 1 is very stable. So good thinking on that. I do agree with you that when I see that word increased, it makes me think, yeah, we probably should investigate that. So let's stay with 1 for just a minute here. Prednisone, 60 milligrams orally. Do you feel like that is going to help number 1 right now? No, it's a PO medication. It's going to take some time to have effect. And that's a chronic medication that's used long term. So even though I am worried about the word increased in number 1, I don't think it's my most immediate patient to go see, because the effect of that medication when given PO is not gonna take effect right away. All right. So here's where we're gonna land. Number 1 is stable. Number 3 is stable. Number 4 is stable. 2 is our unstable patient. Okay? Patients with myasthenia gravis, we have a little trick that we like to use. This might help you remember. MG, mind to the ground. That helps you remember that myasthenia gravis is descending, mind to the ground, descending muscular weakness, and it usually occurs rather quickly. So once they go into crisis and they start having muscle weakness, it moves downward from the eyelids to the cheeks, to the mouth, to the swallow, to the airway. Yep. Now with multiple sclerosis, there's more of a gradual, and my multiple sclerosis patients don't often experience a crisis the way myasthenia gravis patients can experience myasthenic crisis. So when we have 3 stable patients, we don't even have to move on with the rest of our rules on our poster, because we just have 1 unstable patient. They need that pyridostigmine sub-Q immediately. It has a short half-life, and it'll take effect rather quickly, and hopefully, we're jumping, Michael, and hopefully it will help with that muscle weakness right away. All right, our slides are jumping. Here's where we paused. Any more discussion on this one? You guys okay with that? It's kind of a tough one. We're good? Okay. Okay, good. Let's see if we can do, I would like to do the next one. We'll see. We'll pull up new slides if it jumps again, okay? Let's see if we can get through this select all that apply together, and then I actually have a little surprise for you guys. So here we go with number 12, back to our decision tree poster. The nurse instructs a client about the use of clonidine hydrochloride transdermal patch. Which statement indicates further teaching is required? Now, select all that apply are always, you're looking for something right or something wrong, and of course this one is looking for something wrong. And what is clonidine hydrochloride? It is a blood pressure medication. It can be used as antipsychotic, but when it's used in patch form, it's most commonly used for blood pressure. So it's a blood pressure patch, and I'm looking for something wrong. So I'm going to use step 5 and evaluate each of these, asking myself, is it wrong for them to say, I remove the patch before my shower each morning and put on a new one in the evening? So that means my patient's going all day long without their blood pressure patch on. Does that require further teaching? Is it wrong? Yeah, it's wrong, so it gets a check mark. I'm looking for something wrong. Is it wrong when they say one time I put it on my right arm and the next time I put it on my left arm? No, that's good. I want you to change the site where you apply your patch. Is it wrong when they say, number 3, when I get out of bed in the morning, I move slowly so I don't get dizzy? That's good, because antihypertensive meds can cause orthostatic hypotension, which increase the risk for falls. So 3 is good, and I'm looking for something wrong. Number 4, if I experience any difficulties, I will take the patch off immediately. There's the strong word again. So let's think about this in the context of the situation. A blood pressure patch medication means the patient has a consistent absorption of the meds. So do you want them to rip it off immediately? No. If they take it off immediately, you're right that it won't immediately stop working, Ada, but taking it off immediately increases their risk for rebound hypertension. Yeah, so if they have problems, we don't want them to just take it off immediately. We want them to call the healthcare provider and report their problems, not just take the patch off. Okay, good. So that one is wrong. Number 5, I'm so glad this medication will begin working quickly so I will feel better right away. Now that is wrong, right? First of all, hypertension doesn't usually cause patients to feel bad. It is the silent killer. You can have hypertension and feel completely normal. But secondly, patch medications, you don't put the patch on and suddenly the patient says, oh, wow, that medication is working so well, right? It takes time for that absorption to reach therapeutic level. It can take several days, really. So that one is wrong. We will check the box for it. And 5, sometimes the medication makes me feel sleepy in the middle of the day, so I take a short nap. Is there anything wrong with that or concerning? No, that's okay. If your medication makes you feel a little sleepy, especially if it's happening at the same time every day, that's usually due to taking the med at the same time every day. Fantastic. So we just go back and make sure, like double check ourselves. Because have you ever checked the boxes, but you accidentally checked the wrong ones? Like you knew the content, but you just messed up the check marks? Yes. Oh my gosh, Nikki. So we use step 5 of the tree and we go back and we double check that I checked the ones that I intended to check. Just takes a little bit longer time, but we want to be accurate rather than being fast. Okay. So that was an awesome first hour. Before we go to break, I'm going to do something with you called challenge. Challenge questions are where I give you 5 in a row, and after 5, I will come in and discuss the correct answers. So I stop my camera, I bring in a timer, and when we start the timer, we will watch the poll, and as soon as the timer runs out, we're going to flip it to question 15. I'm not even going to say anything, okay? So we'll do 14, 15, 16, 17, and 18. Go for it. You are welcome to use the chat if you want. Just don't put your answers in the chat. And then I will speak to you after question 18, and then we'll take a break. Good luck. I think I forgot to start the timer for you guys. I'm sorry. We'll give you another 20 seconds. Okay, so we're finishing up our challenge. Let's see how we did here. Good job, you guys. Use the polls, look pretty good. Now remember, when you do these questions on your own, we don't expect you to get them all correct, okay? It's just an opportunity for you to kind of try out the new thinking strategies. All right, and forgive me, I've got a whining dog that just will not leave me alone. I'm gonna have to put her out on our break. So she's sitting here on my lap, I apologize. Okay, so here we go on question 14. After 2 weeks of lithium therapy, what's our most important action? So our topic was priority action with depression on lithium therapy. And what we need to know is that we give lithium to bring them from the manic stage to the depressed stage. So really, this is expected that they're going to become depressed. So I'm going to do my A's and I's. I've got 2 assessments, and number 1 looks to be safe. I'm going to eliminate 3 because I don't think I need to explore the reasons they're depressed. I know why they're depressed, because their medication's working. So I hold on to number 1 as my assessment that looks to be the safe assessment for their safety, and let's see if we can eliminate the implementations. Well, number 2 is a do nothing. And number 4, we don't want to add an antidepressant because that usually will take the depressed patient and put them right back up into mania. So number 1 is my credited answer choice. When they become depressed, manic patients are more at risk for suicidal behavior, okay? And you don't have to bother using the poll because you already did, and we're just going through them now. So we'll just ignore the poll when we're reviewing our practice questions. All right, so number 1 was our correct answer for 14. Now for 15, it says several hours after the insertion of a central venous access device, which just means our central line. We talked about the dressing on that before. And it tells us that it's running at 75, and now our patient is restless and short of breath. So first action means priority action, and the right here, right now problem is shortness of breath. Okay, so priority action means use all the steps of the tree. Assessment versus implementation, and I get to 1 assessment, so I look at that one first. And I hope you guys recognize I don't need that assessment. I know what the flow rate is. The question tells me that it's running at 75. And I don't need to look at the insertion site because that's not going to do anything about the shortness of breath. Now, of course, a nurse can remove the dressing with sterile gloves and inspect the insertion site, but that would be appropriate if I thought the topic was infection. The topic isn't infection. The topic is shortness of breath. So now I'm looking at my implementations. I've got a psychosocial one down there in number 4, so we'll eliminate that because we've got a physical problem. And now between 1 and 3, when I apply my ABCs, they're both breathing answer choices. But which one is going to help right here, right now? Number 1, absolutely. If I focus on number 3, I'm putting the equipment ahead of the patient. And number 3 doesn't immediately help with shortness of breath. Now, may they need a chest tube? Absolutely. They may need a chest tube because they may have a pneumothorax from the insertion of the central line. But elevating the head of the bed before I leave to go get a chest tube equipment, elevating the head of the bed will help right here, right now. You guys did great on that one. It was like 80% correct. Good. Okay, for number 16, we got a phone call. Phone call from a client taking Cipro, which is a fluoroquinolone antibiotic for 3 days, and now we've got signs of a hypersensitivity reaction. So which response is best? And we can evaluate each of these thinking, right to step 5, is the outcome of this going to be good for my patient who I'm on the phone with, and they may be having a hypersensitivity reaction. So, did you use a new bath soap? Not relevant. Call me back if the rash gets worse. It's a do nothing. When do you take the medication? I don't need that information. The bottom line is, right here, right now, well, we're going to do it that way. Hold on. So the bottom line is, right here, right now, 4 is going to be best. You're having a rash related to your antibiotic. The safest thing I can tell you is to stop taking the medication. Okay, what I just did was, I did this as an evaluation question, but the slides on the screen, forgive me, are doing this as a priority question. Yeah, I'll get there. 1 second, Nicole. So if we do it as a priority, that's okay. You can do it both ways. I've got 2 assessments. Number 1 and number 3 are irrelevant right here, right now. Because whether you used a new bath soap or not, the safest thing a nurse is going to do is tell you to stop taking this medication anyway. Because the next dose could be the dose that is fatal. And then the timing of the medication is irrelevant. So I would get rid of my assessments. Then I look at my implementations. They're both physical. ABCs don't apply. And then's when I would eliminate number 2 because it's a do nothing. So we're left with 4. Now, Nicole, great question. Is this within our scope of practice? And it absolutely is. Okay? For the NCLEX, the RN absolutely can tell a patient to stop taking a medication. And we do that because we believe that it is the safest information we can give them. We know that if you have a rash and you're allergic to this medication, the dose that leads to this. So we up a med. What we can't do is change a dosage of a medication. All right? So you might want to jot that down. An RN can hold a med, an RN can stop a med, but an RN cannot change a dose of a med. Because that'll come up again. We'll talk about that a little bit more in some future questions, okay? So after that, Shannon, the next step would be to notify the healthcare provider, and the healthcare provider will probably order a different antibiotic for whatever the infection was in the first place. And then Serena, that's a good question. So many students think that what Serena just posted there, allergic reaction would show up right away. So this question is also about reminding you that although it's less common, allergic reactions to antibiotics can show up at any time during the course of the antibiotic. So it's not always after the first dose or the first day. In fact, if you're taking antibiotics for 10 days and you develop a rash on the 10th day, we're still going to call that an allergic reaction, just to be safe. Okay? So that's a good one there. So we want them to stop it right away. Don't take the next dose. And then, of course, the follow-up to that would be notify the healthcare provider and obtain a prescription for a different class of antibiotics. All right, for 17. Now, this was a tough one. Yeah, Hugh, it's the best of the answers up there. Okay? All right, so this topic was about medications that require frequent blood glucose monitoring for our patient that has diabetes. Prednisone increases blood glucose. Prednisone is a steroid, which is a hormone. Estrogen is also a hormone, and hormones increase blood glucose. So we check the box yes for number 2 as well. Patients who take estrogen, if they are diabetic patients, they should monitor their blood glucose frequently because estrogen will increase blood glucose. And then number 3, no, that's an ACE inhibitor. 4 is calcium channel blocker. That does not impact blood glucose. Number 5, yes, beta blockers can cause hyperglycemia, but more commonly what they can do is mask hypoglycemia. So a diabetic taking a beta blocker should be advised to check their blood sugar more frequently. And then number 6, no, spironolactone is a potassium-sparing diuretic that has no impact on blood sugar. So most of you got number 1. Some of you got number 2, and some of you got number 4. But hey, that's okay, right? It's not supposed to be easy. We learn from each and every question, all right? So atenolol can cause hyperglycemia, like it can elevate the blood glucose. But really what's more common, what happens is because beta blockers reduce the heart rate, you know how when people become hypoglycemic, they get tachycardic. But if you're hypoglycemic and you take a beta blocker, the beta blocker is going to reduce that heart rate so the patient won't feel a tachycardia that alerts them that they have hypoglycemia. So beta blockers mask hypoglycemia. All right? Finally, for number 18, clopidogrel is an antiplatelet aggregator. This is an evaluation question. We are looking for the one correct statement about this medication. So we evaluate each of these, and number 1 is not correct. We don't want you to take ibuprofen NSAID with clopidogrel. That increases the risk for bleeding. 2 is not a true statement. You do not have to have blood test monitoring done frequently while taking clopidogrel. That is more a statement of warfarin. Number 3 is our true statement. You should not take ginkgo for memory problems while taking clopidogrel. So 3 is our credited answer, and 4 is not a true statement. It is not true that you must take a daily multivitamin pill while taking clopidogrel. You can take a daily multivitamin, but it's not absolutely necessary. So must was a really strong word in number 4, and that makes it an incorrect statement. So the truth here about number 3 is that ginkgo thins the blood and increases the risk for bleeding. And there's a couple other G's: garlic, ginger, and ginseng. So ginkgo, garlic, ginger, and ginseng will all increase the risk for bleeding and shouldn't be combined with other meds that thin the blood. All right, so that was a lot of information. How did you guys do there? Can you tell me in the chat if you got 3 out of 5 or better? That's a good 5, 6, and some excellent. Great. Now, if you did a goal of 3, we're just here. We'll do another 5 practice challenge questions again at the end of our second hour. So I hope you liked that. We're going to go to the break room and take 10 minutes, and when we come back, we'll go right back into practice questions together with me doing them with you, and then we'll see how we do when we get to the next challenge. All right? You guys are doing great. Time flies when we're having fun here. Enjoy your break, and we'll catch up on the questions and the private chat, and we'll see you in 10 minutes. Thanks.